Dr. Carlos Clark here with one question. Do you snore at night? We'll be talking about that right now, so stay tuned. Your sleep could be killing you. Carlos Clark, MD here. Thanks for joining. Today we're going to talk about obstructive sleep apnea. Have you ever been told by your significant other that you snore? They have to wake you up, nudge you. God forbid, have you ever woken yourself up? Ever gasped for breath? Any of the above? Also, have you been fatigued during the day? Do you have headaches? Do you, God forbid, have heart problems or high blood pressure? Or do you just breathe like this? Well, you may want to check with your physician because you may need a sleep study. These are indications that you may have sleep apnea, and it's very common and it goes underdiagnosed quite often. Legal stuff. Always remember, this video is for informational purposes only. Do not use this as medical advice. Always consult the guidance of your personal physician. Moving onward. So, risk factors for obstructive sleep apnea. Typically it can be related to age. Starts out at young adulthood and can progress up to the 6th and 7th decades of life until it typically plateaus. Men are 2 to 3 times more likely to get sleep apnea other than their counterparts, the females. However, females do have a little bit of increased risk around the menopausal time. A lot of obstructive sleep apnea is related mostly toward obesity. You've got the BMI calculation as that goes up. We also look at things like how many times a day you become fatigued, the waist to hip ratio, neck circumference. These things are all tied in together with making the diagnosis. Other risk factors include cranial or facial abnormalities, chronic sinus problems, as well as the obvious thing, smoking. So one of the obvious questions is, what exactly is going on during sleep apnea or during an apneic episode within the body at night? You're unconscious, so you don't know what's going on, but there's a lot going on in your body. Basically what happens is the oxygen level to your brain and organs gets reduced when you snore or the air is obstructed. You're snoring, etc. So what happens is the oxygen saturation drops and your body only knows how to do two things. That is increase your heart rate and increase your blood pressure. And what this does, this puts your body under an extreme amount of stress during the night. Hence the reason that you're so fatigued during the day. Put stress on your heart. You secrete cortisol and all types of stress hormones, and it can even affect your blood sugar. And by the time you get up in the morning, you are beat. You feel so fatigued, you feel like you've just been in a fight. What this in turn does is make you feel like you have not gotten a very good night's sleep, which is true. But the knee-jerk reaction to that is what? Take a sleep aid or a sedative. So I think you know where I'm going here. If you take anything and like that and you think you may have sleep apnea, or if you have sleep apnea, you're not wearing your CPAP, take Benadryl, NyQuil, or God forbid you're on Ambien, Xanax, or anything like that, and you have sleep apnea, as you can see, when you put the puzzle pieces together, this is making it worse. You're actually killing yourself. So that is a very bad thing to do. So if you're doing that, go see your physician, get a plan, let's get this fixed. So you may have sleep apneas. You've got some of the risk factors, you're kind of concerned about it, or maybe you just don't know. What happens next? First thing, go to your primary care physician. Let he or she know, and typically there's a little questionnaire that you answer, and that will tell us if you qualify for a sleep study. What happens next is they will run it through your insurance, obviously, and they will see if you qualify for a 2-night study or a 1-night study, which is what they call a split study. Typically what they'll do is have you come in at your normal bedtime. They will hook you up to a pulse ox to measure your oxygen level and some electrodes on the head to monitor your sleep waves. So during the night they will determine if you have sleep apnea. Depending on which study you qualify for, the last half of the night you will be set up with a trial of a CPAP, which is a machine that actually can blow air in when you're supposed to be inhaling. Sometimes you can even get a BiPAP that does inhaling and exhaling assistance. So to see if that will help out your symptoms if you qualified either the first half of the night or the first night, depending on what your insurance covers. Just to be on the safe side, it's good if you actually call your insurance company and verify some details with them regarding sleep studies. I've had some patients in the past that had some really weird scenarios, like the insurance would cover the test but wouldn't cover the CPAP if they qualified. It's just kind of, I don't know, I've had some weird feedback, so make sure you call your insurance and confirm the coverage for sleep apnea and sleep study test, along with the CPAP machines if you need one. One of the complaints I get, which is understandably so, is, Doc, I just can't go in there to do the study. You know, it's in a strange place. I have all these wires and things hooked to me, and there's no way I can sleep. Understandable. Totally get it, and I don't know that I wouldn't be the same way. Some people go through the study fine. I will say they are working on some home studies. They're not quite as comprehensive because they don't have the monitors for the brain waves, but they can monitor your oxygen saturation. Again, check with your insurance. These are still being worked on. They're still being refined. So just throwing that out there in case you're thinking that, hey, there's just no way I can do the study. There may be some home studies available for you. So you've just completed your sleep study and you have sleep apnea, assuming. What's next? Next, they will determine what type of CPAP that you need, or BiPAP, which is in and out, which I was speaking of earlier. So they will give you pressures that will be programmed in your machine, or you may have an auto titrating machine, which is what most of them are today, where the pressures adjust based on how well or how unwell you're sleeping. So the main thing I like to tell my patients here is, don't give up. There's several different types of masks. There's really small masks that just go to the nose. There are big, kind of almost full facial masks that you can wear. Give them all a try, see which one you tolerate the best. And just give it a full go. This is your well-being, and understanding how many other comorbidities or other health problems this is tied into, you really can't afford not to address this if this is something that you're having to deal with. So anyway, hey, listen guys, I really appreciate you tuning in. This is actually my first video. There's more to come. Please feel free to subscribe. Click on the bell button so you'll get the notifications when I do a new upload. If you have any comments or suggestions, please leave them down in the comments. Be glad to answer any questions, or if you have a topic that you'd like me to cover, be more than happy to. But listen, I really appreciate you tuning in, and we'll see you soon. Thank you.